I'm the Executive Director in the Ministry of Health and Social Services. I will direct the short program here of this press conference being hosted by the Honorable Minister of Health and Social Services, Dr. Kalumbi Shangula. By way of establishing the protocol, I recognize, of course, the presence of our Honorable Minister. I recognize the presence of our development cooperation partners, either from the UN system or from friendly governments that cooperate and support the Namibian government in general and the Ministry of Health and Social Services in particular. I recognize the presence of our invited guests, our staff members who are here this morning. This being one of the first public events for the ministry for the year, allow me to wish you all the best for 2022. As I said, the program will be short. The minister will deliver a statement on the two items he wants to share with the Namibian public. There will be questions from the media, and basically that will be that. Without further ado, ladies and gentlemen, join me in welcoming Dr. Kalumbi Shangula, Minister of Health and Social Services, to the podium. Honorable Minister. Thank you.
Thank you very much, Director of this short proceeding, Mr. Ben Nangombe, Executive Director, Ministry of Health and Social Services. Allow me, in the interest of time, to stand by the protocol as announced by the Director of Proceedings. I just want to add that I welcome you all to this press conference. I want to greet somebody I haven't seen for a long time, Dr. Norbert Fester. We have worked together for many years. So you are welcome to this event. I thank you all for making time to join us this morning. Namibia appears to have a high propensity to disease outbreaks. The country has experienced disease outbreaks in recent years, including plague, hepatitis E, COVID-19, malaria, and of late, typhoid fever. I will share with you, and through you, the broader public, the confirmation of typhoid fever in the country. I shall also announce the end of hepatitis E outbreak in Namibia. Let me start with the bad news. The first matter I wish to share related to the detection and confirmation of typhoid fever cases in Namibia. On the 27th of January 2022, the Ministry of Health and Social Services confirmed a case of typhoid fever from Windhoek district. Following the report of the first case, 9 contacts, including 3 close contacts, were traced and tested for typhoid fever. Among the 3 close contacts, 2 tested positive. Typhoid fever remains a serious public health problem throughout the world. The World Health Organization's estimated incidence of 16 to 33 million typhoid fever cases globally every year, with 500,000 to 600,000 deaths and case fatality rate of between 1.5 and 3.8%. With more than 80% of global cases, South Asia is the most commonly reported region for the occurrence of typhoid fever. In the last outbreak in the Democratic Republic of Congo, between 20 September 2004 and January 2005, no less than 42,564 cases of typhoid fever were reported, including 214 deaths, and 696 cases of peritonitis and intestinal perforation. Cases of typhoid fever have been reported previously in Namibia, especially in Kavango East and Kavango West, due to the use of river water. Windhoek district in Khomas recorded only 1 case of typhoid fever in the past 5 years, between 2017 and 2021. Typhoid fever is transmitted through blood and water contaminated by feces and urine of an infected person. Polluted water is the most common source of typhoid transmission. Food such as raw vegetables and fruits, contaminated milk products, usually from hens of typhoid fever carrier, and flies are common sources of infection. People can transmit the disease as long as the bacteria remain in their body. Most people are infectious prior to and during the first week of recovery, but 10% of untreated patients will discharge bacteria for up to 3 months. Typhoid fever can be treated successfully with antibiotics. However, incidents of resistance to common antimicrobial have been reported widely. Persons with typhoid fever carry the bacteria in their bloodstream and intestinal tract. Symptoms include prolonged high fever, fatigue, headache, nausea, abdominal pain, and constipation or diarrhea. Some patients may have a rash, and severe cases may lead to serious complications, even death. Common risk factors in the development of typhoid fever are travel to typhoid fever endemic areas, poor hygiene practices, lack of sanitation facilities, proximities to flying insects feeding on feces, contacts with someone who recently suffered from typhoid fever, recent use of antibiotics, and low immunity due to diabetes mellitus, uncontrolled HIV/AIDS, and other immunosuppressive conditions. A diagnosis of typhoid fever can be confirmed by analyzing samples of blood, feces, or urine. This will be examined under a microscope for Salmonella typhi bacteria that causes the condition. The public is therefore urged to exercise the following measures: maintain good hygiene and sanitation, including hand washing. Ensure drinking safe water or boil water before consumption. Food should be carefully prepared, and food handlers need to be especially vigilant with regard to hand washing and wearing of gloves. Avoiding raw and uncooked food can also prevent the spread of typhoid fever. Food that has been left over from a previous meal should be reheated adequately before being consumed. If one is a close contact to a typhoid case and showing symptoms, it is advisable to seek medical attention without further delays. According to the World Health Organization, a disease outbreak is the occurrence of disease cases in excess of normal expectancy. So far, the reported cases do not meet the WHO definition to be classified as an outbreak. However, further investigations are ongoing. The 3 detected cases, they are all in a stable condition and are receiving medical treatment. The ministry have learned through social media about the possible association of typhoid fever cases in Windhoek and Swakopmund to the typhoid fever cases reported in South Africa. Typhoid fever is one of the priority diseases under our national surveillance system. So far, we've only confirmed the cases described above, but we remain vigilant to be able to detect typhoid fever cases through our surveillance system. The public is urged to remain calm and comply with the control measures put in place in order to contain and prevent further spread of infection. The second matter I wish to discuss this morning relates to hepatitis E in our country. Namibia declared hepatitis E outbreak on the 14th of December 2017. By the 4th of February 2022, a total of 8,092 hepatitis E cases were reported, of which 2,124, or 26.2%, were laboratory confirmed, and 4,738, or 58.6%, were epidemiologically linked to the confirmed cases. A total of 1,230 cases, or 15.2%, were classified as suspected cases. A total number of 2,435 specimens were tested negative for hepatitis E and were therefore discarded. A total of 66 hepatitis E deaths were recorded nationally, with a case fatality rate of 0.8% since the outbreak began up to September 2020. Among the recorded deaths, 27 were maternal deaths, representing 41% of the total hepatitis E deaths and 6.2% of all the reported maternal hepatitis E cases. 4 hepatitis E deaths were recorded in 2020, of which 2 were maternal deaths. The first one occurred in February 2020, and the last one occurred in September 2020. No hepatitis E deaths were recorded since then. Hepatitis E cases have significantly dropped in all regions since the last quarter of 2020. The last few cases were reported in Windhoek, Walvis Bay, and Okahawa districts. The acute phase of a virus outbreak is defined by the propagation of the virus within communities through transmission of the virus from one person to another. With respect to hepatitis E, this phase is considered to have been interrupted when no confirmed cases are detected for a period of 20 weeks, or 2 times the maximum incubation period for hepatitis A infection following the last potential exposure to the last case has occurred. For endemic conditions, an outbreak ends when the number of new reported illnesses drop back to the number ordinarily expected. The hepatitis E epidemiological curve in Namibia shows that hepatitis E cases have consistently declined. In the last 20 weeks, which is equivalent to double the incubation period of this virus, 33 cases presented with acute jaundice syndrome, of which 24 were discarded and 9 were suspected to have hepatitis A. Out of the 9 cases, 6 have developed symptoms within the last 20 weeks. 3 were from Windhoek and 1 each from Walvis Bay, Usakos, and Okahau districts. None of these cases were laboratory confirmed. Neither were they epidemiologically linked. With the above background, it's now my pleasure to inform the nation and to declare that hepatitis E outbreak in Namibia has ended. It is, however, important to emphasize that the hepatitis E surveillance system remains in a state of heightened alertness and vigilance in order to pick up any rise in the number of cases anywhere in the country. Should new cases occur, they will be promptly and thoroughly investigated in order to respond appropriately and in line with the prescriptions of public health. Out of abundance of caution, the following districts will continue to submit their line list as from today, according to the timelines which I'll mention below, after which they may discontinue if no cases are suspected during that period. For Windhoek district, up to the 16th of March 2022. Usakos district, up to 31st of March 2022. Walvis Bay district, up to the 19th of April 2022. And Okahau district, up to the 24th of June 2022. Hepatitis E continues to be part of weekly integrated disease surveillance and response reporting system from all districts. The Ministry of Health and Social Services express gratitude to the following stakeholders for the concerted effort to bring the hepatitis E outbreak in the country to an end. The Office of the Prime Minister, offices of the Governors and Regional Council in all affected regions, Ministry of Agriculture, Water and Land Reform, Ministry of Information and Communication Technology, Ministry of Education, Arts and Culture, Embassy of the Government of Japan in Namibia, the World Health Organization, UNDP, UNICEF, UNFPA, U.S. Center for Disease Control and Prevention, City of Windhoek, and other local authorities, Namibia Institute of Pathology, University of Namibia, Red Cross Society of Namibia, media houses, Coca-Cola Company Namibia, Development Workshop Namibia, Eka Biotech, and all other stakeholders. Namibia has a good track record in eradicating or eliminating outbreaks. Among them are plague, Crimean Congo hemorrhagic fever, polio, and now hepatitis E. This gives me confidence and optimism that the same fate will befall COVID-19 as long as we get vaccinated and observe public health measures as announced from time to time. I acknowledge with gratitude the efforts of our healthcare workers in ending hepatitis E in Namibia. I thank the public for support and cooperation and for complying with our messages. We have eradicated polio in Namibia a decade ago through mass vaccination. We can do the same with COVID-19. Have faith in your government. Let us get vaccinated in order to return Namibia to a normal life. Let me thank you for your kind attention.
Thank you very much, Current Minister, for the statement. Namibia has a good track record in eliminating outbreaks. I think that speaks to the dedication to work of the entire health system, particularly the public health system. That said, I indicated that there will be a chance for questions from the media. I will ask you, if you have any question, to please just identify yourself and pose your question. Indicate to whom you are posing that question. As we indicated, we have some of our development cooperation partners here. You may want to pose questions to them, if any, or to the minister or the technical staff in the ministry. We have just about 10 minutes for that activity. So allow me to open the floor for questions, and also to announce that the event is being streamed live, so that the general public is following and are hearing from the proverbial horse's mouth about the historic development of us eliminating the hepatitis E outbreak in our country. The floor is open for questions. Please identify yourself and pose your questions. Thank you. If there are no questions, Dr. Shangula has told me one thing, that if you share something with people and they don't ask questions, there are only two options. Either it was so clear that they understood everything, or it was so vague that they didn't understand anything. I want to go for the, for the former. I think the minister was very, very clear. The nation has heard, the media has transmitted the message, and with that, we have come to the end of this press conference. I thank you very much.